So hello, everybody, and welcome to the latest webinar for Cosmetic Laser Dermatology. I am very excited to welcome you to our webinar and introduce you to our wonderful speaker, Dr. Kimberly Butterwick. Hello. Dr. Butterwick is a highly esteemed board-certified dermatologist who has been with the practice for decades, since the very beginning, and she is recognized as one of the most renowned skincare experts in the country. She teaches physicians and dermatologists all around the world, and she is an expert on all types of cosmetic procedures, from injectables to lasers to body sculpting to just general anti-aging procedures. But today, specifically, she is going to be talking about Silhouette InstaLift and her technique to provide a non-invasive, non-surgical facelift. So without further ado, I will hand it off to her.
Thank you so much, Emily, and thank you everyone who's tuning in now and in the future. And I'm going to talk today about the Silhouette InstaLift. This is something I'm kind of excited about because it's a little different than other things that have been available, and it does something that other non-invasive treatments can't do. So we'll just get started and we'll talk all about these thread lifts, and in particular the Silhouette InstaLift, the Silhouette Sutures. And even though that's kind of a scary picture down below, I'll make sure that there's not going to be anything too unsavory on this lecture this evening. So these are my disclosures. I do teach for Suniva and Sinclair about how to do the Silhouette InstaLift. I'm one of their trainers, and I do like to speak about these sutures because I think they're excellent. I only like to speak about what I really believe in. And so tonight, what we're going to talk about is first, why do we even need to bother with suture lifts? And so we'll discuss a little bit how we age and why these have a unique niche. But it's based on understanding of aging, which is important. We'll talk about the other options you can do besides this for lifting the face, and what exactly InstaLift can do. We'll show you some before and afters and some patient experiences. And then we'll just talk about what you do afterwards, how long it lasts, and that sort of thing. So first, why are we even talking tonight? Well, because I would say at least half my patients come in like this patient and go, oh, I hate my lower face. I see this all the time. It's very distressing. And probably our time that we've been spending on Zoom hasn't helped, because you see yourself, you see your face aging in a way that's really unpleasant. Or if you happen to take a selfie and your camera's down below and you shoot up at the lower facial laxity, it's kind of scary. So this is such a top concern of many of my patients of all ages, actually. But sagging happens to everyone over time, no matter, it can start sort of early, but it happens in all ethnicities, all races, male and females. I'm showing mostly females. Sadly, it happens to us females a little faster than males. But this is something we see as an inevitable part of aging. Even beautiful Jennifer Aniston, starting to age now, starting to have some sagging, some dropping down of tissues at age 31 versus age 48. So it happens to even the beautiful people. So what is exactly happening? We see this progressive deflation and descent. So maybe Jennifer Aniston, about 34, started noticing some shadowing, because starting at age 30, you start to lose a teaspoon of fat from your face every year. So that's the first thing that starts happening, is just creating some subtle shadowing. But then it gets a little worse. The face falls down a little bit, and until it gets to a much more progressive state. And not only does our face change, but this creates an expression that we might not feel. Like the woman in the lower corner looks a little bit mad. She looks a little sad. She looks kind of tired, and she might feel perfectly fine. But that's the sad thing about aging, is that it also makes you look like you have certain emotions that you don't feel. So we can feel really wide awake, but not look that way. So sagging is a multi-layered process. It's not just the skin sagging. Living in Southern California, we do have photoaging on the surface, but that is more of the crinkles and the wrinkles on the surface. The thing that causes the sagging is the shrinking of the fat pads. They're not holding the face up, so the face falls down. The muscles aren't quite doing their job to hold the face up. And then there's bone loss and remodeling of our underlying skeleton. And that's sort of like the framework of the house. And when that changes, there's even more sagging. That's why we tend to get worse over time. The fat loss, as I said, kind of starts happening in your 30s. And the cheeks will sort of descend down and create the jowls that we hate. But you may not know how the skeleton changes. The maxillary, the mandibular bone, the jawbone gets a little smaller. This maxillary bone in the middle of the face tilts back and gets smaller. Even our orbital openings get a little wider and larger, so the tissue just falls and gets a little, that starts to create the shadows, and then the framework under the skin isn't supporting it, so everything falls down. And we lose the youthful contours of the face. We call that the OG curve, when the cheek kind of comes out so nicely right here, and that we should see that. And as we age, all of this fat flattens and falls down into the jowl. There's also ligaments way on the side of the face, and their job is to kind of hold everything up and to create stability for the face while we're eating and doing other expressions. And those ligaments will tend to sag, but they're sort of key for the InstaLift because we use these ligaments to anchor our sutures. So we'll talk about those a little bit more. So this is the familiar thing, but you see that the lower face tends to take the brunt of all this sagging, because the upper face will look not as good as we age, but the lower face looks especially bad. So the lower third is pretty much what gets people to either do a facelift or really wanting to do something to lift. The other thing that happens is all this is happening is our facial shape will change from sort of a nice oval to getting more sort of square or odd shapes. And you can trace out someone's face. A younger person will have more width in the mid face and more tapered, and become more oblong. These are tracing those people you just saw. The man had a nice oval, and then it got elongated, the face, kind of this long, narrow face is a sign of aging. And there are a lot of different facial shapes that we admire. The most common would be the heart shape and the oval, but and some ethnicities like a rounder face, but nobody likes it when it squares off at the bottom. So this heavy lower square face is not an attractive feature. And that's what kind of makes you look sort of sad and tired. And that's why we look for non-surgical lifting. So what are the treatment options that we have for this? Well, let's take a look. And hopefully that wasn't too technical for you. I've actually adapted this lecture from a lecture I give to physicians. So it's kind of nice to know you're getting similar information, a little less detailed. But this is what we think about when we look at the face and we try to analyze what's happening. Now, there are many options to lift the face. And these are gaining more and more popularity as everyone ages and sees their face. But what we think about when you come in and we think, what would be the best thing for you? First we think, what's the most effective? What's the efficacy? What thing is going to lift your face the best? What's very, very safe? not too expensive, and what has downtime, what doesn't have downtime. Some things like our Take 10 lasers, just super tight, cause tightening of all the surface and all the wrinkles, but it takes about 10 days to heal. Other things have minimal downtime. So we talked to you about what amount of time do you have. But lasers don't really lift this kind of heavy stuff. That's where we have to go into different types of options. And we call this the 4 R's. And we have different things that can be used to help with lifting. Actually, if we start with relaxing, if we relax muscles with botulinum toxin, Botox, Dysport, Xeomin, Jeuveau, if some muscles pull down, and when we relax them, like this here and here, you get lift on your upper face. So we can do a Botox brow lift with Botox. We can treat the muscles that are pulling your face down, this one here, muscles in the neck, to stop them from pulling down. So the face will go up to some degree. The next R is refilling. And you've heard of a liquid facelift. We can use fillers to actually replace some of the volume loss and lift everything up. And then we, as I mentioned, resurfacing, the orange one, that's more for the surface problems, the smoker's lines, the laxity of the eyelids. You can get major tightening around the eyes and lots of tightening of these fine little creases. But for deep laxity, when all the tissues are hanging down, as I showed you, there we need either traditional surgery, ultrasound, or radio frequency devices to tighten the face, or now we've got the suture lift, and that's what we'll talk about. First, I'll just show you what we can do with a liquid facelift. We can put fillers in the cheeks and temples, a little bit along the jawline, and we can actually lift some of that laxity along the chin and give a rejuvenated appearance and even kind of open up the eyes. This was just with the filler called Radius. So oftentimes we can get a pretty good lift just with fillers. But we've all seen those people who go just a step too far and try to lift everything with fillers. That's not a good idea. We don't like that overfilled, unnatural look. So if you've had some filler, but you think, I don't want any more, but I've got to get this lower face tighter, then we've got some other options. We can use something like monopolar radio frequency, like Thermage. There's micro needling radio frequency that can tighten. You've got to put heat into the skin to get some tightening. And this, we can get some tightening along the jawline. You can't exactly pick up the nasolabial fold and this marionette with the tightening devices. They're good. They're helpful to slow down aging. They won't get you quite as tight as you want a lot of times. Or we have microfocus ultrasound. We have Ulthera, and there's a new one called Softwave that I actually personally just tried last week. And we use these devices. There's no downtime. They're safe on all skin types to tighten, get some tightening of this lower face. But it still isn't quite as tight as we like. And you can't choose exactly the directions that you want with tightening devices. It doesn't really lift the cheek, and it does some tightening of the jowl, but not all the way. So thread lifts, you might not have heard that much about until recent years, but they're an increasingly popular choice. There was a survey of members of the American Society of Dermatologic Surgery, and thread lifts increased by more than any other procedure. They're not the most common procedure compared to PRP or microneedling, but they went up 637% in 2019. And so they're gaining more and more popularity. So when you really want to lift this up, sometimes you think, I just got to bite the bullet and get a facelift. But so many of us want to avoid a facelift. Maybe we're afraid of looking too pulled. Maybe there's some health issues. You don't want to take the downtime. You don't want general anesthesia. There's reasons why many of us don't want to, hold off on a facelift as long as possible. Now, sometimes we'll tell you, you know what, you really got to go get a facelift. Because the tissue is so loose that you can pick it up and put it over your ears. Sorry, but we don't have any non-invasive ways to do that. Then it's definitely facelift time. But that's why there's been this ongoing search for less invasive options. And the search with sutures began some time ago. There's different types of them. But back in 2004, there was this Aptos thread. And I actually worked with another thread in the early 90s, or sorry, early 2000s, the contour thread. The trouble with these sutures were they were permanent and they could twist on occasion or have a problem, and they were very difficult to get out, and you were kind of stuck with them. So it wasn't, they kind of weren't that popular, and now nobody really uses them anymore. But there's been an evolving technology in suture design, suture technique, and how you put them in. And now we have absorbable sutures. This got me interested again because I thought absorbable is better. You don't want something that you're stuck with forever. And like the old ones had some trouble with knots and so forth. But there are different absorbable sutures. And this means when we say absorbable, it means the body's going to see it, break them down a little bit. And as they break them down, it builds collagen. So the collagen will kind of hold you up a little longer, but it assures that the long-term result is going to be smooth and very nice. And the Silhouette InstaLift was the first and almost only one to be FDA approved to lift the face. And this was in 2017 that we've been doing the suture since then. You'll hear about other ones, the PDOs. That's a different material. There's a lot of different ones out there. Those are more approved to be used as stitch material, not really for lifting, because they don't really last that long. They last about 6 months. So they're FDA approved for suturing tissue, but not really for lifting. But there's a lot of different ones. You'll hear about Euro threads, Nova threads. The ones I like the most are the Silhouette InstaLift, and that's what I'm going to talk about mainly tonight. They're made mostly of this material called PLLA, poly-L-lactic acid. You might have heard of that because it's the same thing that Sculptra is made of. It's a natural material that when placed in the body stimulates a little bit of collagen. We use it for volumizing. We use it for liquid facelifts. We use it to build collagen in the chest, arms, and legs, and even the buttock. But when we use it as Sculptra. But now it's been made into a suture, and it's great for lifting. So the thing about the InstaLift is it has these little cones which have a much bigger surface area for actually lifting compared to the barbs. The barbs can cause more tissue damage, and these cones are actually gentler for lifting. So now I'll just talk a little briefly on technical clinical studies. We actually did an article. I had a student with me, and we reviewed our experience. We reviewed the literature on these sutures, both the PDOs and the PLLA ones, the Silhouette InstaLift. And we found, patients are generally satisfied with all of them. They feel like they look younger. These are with the Silhouette InstaLift. They felt like they looked 3 years younger in one study. Both the surgeon and the patient felt they were very helpful. At 6 months, the PDO patients were still happy with that in some studies. So we do see some positive reports. And in terms of negative reports, these are pretty darn safe. You might get a little bump somewhere, but it's temporary. So even in all the studies that we reviewed, there were no major side effects. The thing about the longevity of the PDO sutures is this results really starts declining by 6 months and was absent by a year. So you have to do these more often. They just don't hold up that long. Now with the InstaLift, we see duration at about 18 months. Some studies say 2 years. No, that you can bruise a little bit, but no real adverse effects. So these are quite nice, and they can be put in the mid-face, the jawline, and the neck. Some of the PDOs are put in the brow or around tissue to stimulate collagen, much like Sculptra. But the InstaLift ones are mainly for the cheek, and the neck is where we use them. There was an expert consensus that reviewed experience with the Silhouette InstaLift, and they all felt it's maintained for 1.5 to 2 years. And that's what we tell patients. It's going to last a pretty good long time. Now, I had some about 3 years ago, and I really liked them, and I've maintained it by doing a few of those other things that you saw. But then it's getting time. I need to get this pulled up. This year I'm going to do it again. So we can make them last longer if we do some additional treatments with them. But still, 2 years is pretty darn good. We reviewed our early experience in our office. And with this procedure, many patients wanted to do it again when the time was up. And that's how I tell if a treatment is good, is patients say, yeah, that was really good, and I want to repeat it again. This was a really good study by a plastic surgeon who does facelifts, and he did the InstaLift on 100 patients. And 2 years later, some patients said, you know what, I realize I really want a facelift now. And that's normal, especially if it's more sagging that you can't quite pick it all up. 25% wanted to repeat this procedure and get it again because it's kind of easy. And 15% still had the effect. So they thought, and like we do, combination treatments with sutures, fillers, and devices will give you that long-term, really nice duration. Now, if you compare a facelift to an InstaLift, what's the difference? Well, you don't really need any anesthesia, just we use some local anesthesia, so you don't need to take any medication or go under anesthesia. It's a quick procedure. A facelift will correct more than an InstaLift. That's sort of obvious. The sutures will stimulate collagen, unlike a facelift. So we do get some filling in when there's volume loss. Much fewer complications with an InstaLift. We don't really have to redo them. A quicker recovery, of course. A facelift will last longer, usually about 7 years, I think, is the commonly given duration for a facelift. And the cost is much less, of course. So it's just much easier to do an InstaLift, but a facelift will obviously do more. The facelift has scars along the ear and behind it, and there really is no scarring with the InstaLift. So kind of the bottom line, it's a quick result. There's little downtime. This is 6 weeks after, and you can kind of see what it does is it takes the volume and shifts it upward. It also shifts it upward kind of towards the eye, which I like. And it pushes everything back. She's a little wider in the mid-face, and that gives that heart shape that is youthful and nice, because she was starting to get kind of loose and falling down a little. Now, she didn't have a lot of laxity, but it's kind of nice to get it when it hasn't all fallen down. So the volume gets shifted upward with this. This is what they look like. They've got little cones on both sides, and I'm going to show you a little bit more detail. There's little tiny knots so the cones don't slide, but the cones will catch the tissue and pull it up on one side, and then they'll anchor the tissue on the ligaments here, kind of like a rope climber with pitons. They'll anchor up here and lift this way. If we do the sutures, it's about equal to, depending on how many we use, about 2 vials of Sculptra. This is done under local anesthesia usually. It takes 45 minutes or so. You get an immediate lift, but then actually it drops down a little at about 3 to 4 weeks. You might think, that wasn't worth it. But then as the collagen is stimulated, it starts lifting more and more and more. And we see that all the time. So I tell patients, you're going to think at a month, you wish you got more of a result, but just wait 2 months, 3 months, 4 months. And that's how all the lifting, the non-invasive treatments are, whether you do Ulthera, Thermage, radiofrequency microneedling. It takes a while for the body to respond to the treatment. I usually do 2 to 5 sutures per side, 1 or 2 in the neck. I usually use these 8-cone sutures, although they have longer ones if you have a bigger face. And first you come in, we take some pictures, we review which way we want to lift the face, clean the face. We do it under sterile technique with sterile towels. We make one little entry site and exit point. And then after we place the suture, we tighten the skin and trim the edges of the suture. Now that looks painful, but it really isn't, because this is numbed up the entry site and the exit site is numb, and we don't have to numb in between, believe it or not. So you do feel that me doing a little bit of the numbing at the very beginning. That takes about 2 minutes, and the rest honestly is not painful. And we can choose however way we want to mark. We can, if you want your nasolabial fold lifted, we can do that. We can do just the jowls. We can do them just the neck. Sometimes I'll just pull a little bit the jowl back. And you can look in the mirror at yourself and think, oh, I just need a little one here, maybe there. So we don't have to, we can pick and choose how many we use. And sometimes we'll do 2 here and a few months later add some more. So it's kind of offers us a lot of versatility. And we can sometimes cross them. We can go one way one time and another way another time, or you can cross them. But in one study they found it's better to pick, you go one direction this way, or you go up, and you can change the direction anytime you want. Now we're going to talk to this patient, and this is how I would probably talk to you in the office. Let me just click on this and hopefully, oh, yes.
Dr. Butterwick, I don't believe that the anybody can hear the video.
Oh, okay. Well, let me.
Sorry about that.
Let me mute that, and I will talk over it. Oops.
Perfect. Thank you.
Except I have to mute it so I don't hear myself. Oh, I have to. Okay, there we go. Should I start it over?
Sure. Yeah.
Okay. All right, there we go. So this is how I talk to a patient. This is Alyssa, and she was telling me that she doesn't like something about her face. And she said she hates these jowls. They're starting to come down. And so it's not too bad, but if you look at the width of her cheeks compared to the width of her lower face, the lower face is getting too wide, and she's kind of sliding down some of this volume here. So that's what she hates. And that's what we women all hate that. And so we sort of see, well, let's see where we could put these sutures. And I thought I would show you what they look like in person. That's the thread in the middle, and we'll show them against the black background where you can see those little tiny cones and the knots in between. So the cones stay in place, and those are oriented different ways. And I'll just show you on the outside how we would place them. These sutures I'm not going to use them again because we take them out of the sterile package, but I showed them I wanted to show you what they look like. And so we kind of placed the cones. I thought, gee, I want to pick that up and I want to anchor it to those ligaments back there. So that's one that'll be really nice for her. We may want to also lift up some of the tissue higher in the face. She's kind of flat in her cheeks. And if we lift her cheek up, kind of like that other patient, we'll push the volume up. That's what I like about this. With the facelift, they cut out the extra tissue on the side. This doesn't cut any tissue out. It just redistributes and puts it back in a youthful distribution. So we can take these sutures and kind of use it to push up the cheek, pull up the jowl. And so when you come in for your procedure, we just kind of talk about, well, let's put one here. We're going to put some here so we can pull it all up and get a nice younger facial shape. So I think that's what we're showing there. We can move on. So let me show you some examples of how we use this. This is a patient who, she's in her 40s and she's starting to just feel like all of this is coming down. She's had some filler in her cheek and maybe in her jawline, and it's just not really picking this up too well. If we put filler just in her nasolabial fold and that marionette, she may look like too chubby in here. So we don't want to just fill that and create all this volume in the center. That's not as pretty a look as pulling some of it back. So we took a suture here. We took one to pick up this little piece here, and then one along the jawline. And you can see, just look at the light reflex in her cheek. It's just this really pretty arc. And it pushed the volume up towards her eyes. That's one of the things I like best about this InstaLift, is it takes this fat that's sort of fallen down and pushes it back up toward the eye in a youthful position. Yes, she still does have a little bit here and here. We tell patients, don't try to eliminate this fold completely because it's natural to have a nasolabial fold. And we can't pull all of this up, but actually, frankly, neither does a facelift pull that 100%. Sometimes a little bit of filler in this commissure would be helpful. But it's just, the InstaLift is a natural, subtle, nice lift. Sometimes patients say, don't lift me too much. I don't want to look overdone. Even if you said, I want to look overdone, you can't do it with these. They're not really strong enough, but it just gives such a pretty pop to the face, which is why I like it. This patient had more advanced aging, and she has kind of this jowl here. She's noticing some sagging in her neck, and things are falling down. You see, she doesn't have a very good jawline, and she's pretty full, so putting in a bunch of filler wouldn't do her a lot of favor. We could do something like a tightening device, but it really won't pick that jowl up, which is the thing she hates. So if we put some sutures, I might have put 4 or 5 in her. I can't actually remember, but I probably put 2 here and 2 this way. And then 1, I love to put this one in and I anchor it behind the ear so that it looks like we've got a much better jawline for her here. We picked up most of that and we were able to lift up the face. So she has just a less sagging of her face without going through too much. This is something that maybe you feel you're a little bit swollen, have maybe one little bruise somewhere. It's much like getting fillers. And you usually are going to be a little quiet for a long weekend, but it's pretty easy to do. I did not put any sutures in her neck, and that may be part 2 of her procedure, where we take a couple sutures to pull the remainder of that neck. She does have a little fat pocket there, and maybe we do cool sculpting. Kybella, if she could put up with the swelling, or some other thermi procedure is really our favorite treatment for really saggy necks. So we can always mix and match and do some other treatments as needed. And this one I think is instructive. She's older, and you might think, oh, someone in their 60s has to have a facelift. Not really. And you might hear that the InstaLift is not good for people with heavy skin. It actually is really good for heavy skin. If you have really super thin skin, you might not be a candidate, but almost everybody can undergo a Silhouette InstaLift. She did have fillers, and she had microfocus ultrasound the year prior. That's why in her 60s, she looks pretty good. But what we did is she hated this. So we put 2 sutures on to lift up her face here, and 1 along the jawline. And we did not put any in her neck at this time. And for this whole 6-month period, we didn't do any other treatment. But this shows you at before and at 3 months, it was better. This is better. This marionette line is better. The neckline could be, that it is better, but we wish it was better. But look at it at 6 months, it's much better, just with giving a little bit more time for this. So you don't want to judge it in the first month or 2 or 3, because it does improve for 6 months, and then it just keeps getting, it'll stay that way for about 18 months, 2 years. When I got mine, at first I thought, I don't see that much, but people would comment to me, gee, your face looks great. And patients who knew me and saw me a lot, then they signed up, because they're like, I have to do what you're doing. So at least I believe in what I do and undergo it myself. Now, how is this placed? We place it in a superficial skin plane, but under the skin. If you catch the underside of the skin, you'll get some dimpling. And so this slide is sort of teaching physicians how to place it, how to know how to get it nice and smooth. So there are lots of tricks, but one thing is patients should not experience any pain or discomfort while I'm putting it in. And if it hurts, you're in the wrong plane. So this should be a very painless procedure. We get a little bit of bunching for a day or 2 or 3. It can swell right along the thread. So I tell people, just kind of lay low for 3 or 4 days. You can still, go on a walk and go to the store. You can wear your mask if it's a little bit more swelling, but it's not very much downtime. This kind of shows how it's put in a cartoon. The needle goes in. This is numb right here. And then when it's placed under the skin in the fatty layer, that does not hurt, and the exit site is numb. Then the little cones go to hold the tissue up. Then you come in the same direction, the same hole, and you come out a different direction and pull the little cones through. And then these cones, where are they? There they are going to pull the tissue up, and these will anchor it. So that's sort of it in a nutshell. Now, this is a patient, a nice picture of me, right? I have to move it along, but this is a patient who just had it. You can see these little numbing dots where it's kind of white, and there's a little mark where the needle went in, and this will show for about 2-3 days, really not long at all. One of my favorite things though, is after I do the InstaLift, I show the patient the mirror, and it's kind of fun because they see something right away. Many treatments you don't see very much, but oh, we won't be able to hear what she says, will we? Well, if you can hear her. Can you hear this?
I cannot hear it right now. Maybe try turning the volume up a little bit. Let's see if it
I'll
works.
put that all the way. Can you hear it or no?
I can't hear it.
Okay. Well, I'll
Apologize.
turn it down. Okay, now she's looking, she says, wow, oh my gosh, what happened to my jowls? She's a little swollen, but she can see her neck, her jawline. She's saying, oh, I can't believe it. It's just so much better. So this is how patients, they feel really good right after. Yeah, she looks funny because she's got those little dots. Those will be gone by the evening. And she feels like it's better around her eyes. And she had deeper hollowing there. So she just likes how it lifted everything up. She was so excited that she said, yes, I'll talk to the camera. I said, okay, well, so that's how we should feel about this procedure. Now, what do you do afterwards? We lightly put some cold packs. It's a little sore, so I would advise taking Tylenol for a couple days. You can put makeup on the next day. We like you to try to sleep on your back and a little bit elevated for 3 to 5 days. If you're a side sleeper, we have you just put a pillow, tuck it underneath so your face isn't right against it. We don't want you to chew gum or move the mouth around constantly for that first week. We don't want you to do high impact sports like tennis or jumping around for 2 weeks. You shouldn't go in steam rooms or saunas. And you want to avoid dental surgery, massages, facials for 4 weeks, because we don't want really anyone to press on those sutures. It takes about 3 days for the body to integrate the sutures. So for 3 days, you're real careful. You don't sing, you don't yell at your kids, or you're just kind of quiet and happy and agree with everybody. And then you'll feel them in there for the first week or 2. You can tell they're there, but then it eases right up. And by 3 to 4 weeks, you don't feel them at all. So they're not bothersome at all. It gives that immediate lift with gradual improvement up to the 6-month point. I like these because we can choose the direction. With the other tightening devices, we get tightening all over, but you can't say, I want to lift this up. I want to lift my whole face side up, or I want to pull my neck back. So that's the niche for these InstaLift treatments, because we can really pick the direction that we want to go. The downtime is really minimal, and we can couple it with other modalities. Sometimes at the same time, we'll do a little filler in the lips, or I've done a light Fraxel laser at the same time. We can do even a tightening device and the InstaLift on the same day or a month later. And as I said, these can be repeated 18 months, 2 years, or in my case, it'll be about 3 years later. Now, are you a good candidate for this? Well, the best people are those who have kind of mild to moderate sagging and jowls. Sometimes I do it just for people who have a really deep nasolabial fold. Most patients who undergo this have already had some filler or Botox. This wouldn't be the very first thing you tried if you've never had anything. It's just better to try a little bit of Botox, a little bit of something else first, I think, before you get to the whole InstaLift. So most patients are pretty happy with their upper face, but they can't correct the lower face all the way, as I've mentioned. Many people that I see say, I never ever want to get a facelift. That's just off the table. They've seen too many people who look unnatural. They may have health reasons. They may want to not undergo general anesthesia. Many people are afraid for their brains and so forth. So there's a lot of people out there that don't ever want to do a facelift. Or maybe they'll say, yeah, I do. I think there's a facelift in my future, but not for the next 2 to 4 to 10 years. You can get by. You can use this to buy yourself some time for sure. Sometimes, in fact, many of my patients are people who have had a facelift some time ago, and they start to sag. Even at 2 years, there might be a little bit of laxity in their sag that it's not staying up as long as they thought. And we can just put in a thread or two and anchor back up. So this is good for people who want to feel like it's too early to have a second facelift, but they want a little bit more lifting. And as I said, this is good for experienced patients who've had fillers, tightening procedures, but they want a little bit more lifting. And they want to avoid the overfilled face, because we can lift a lot with fillers, but you want to stop before it's too big and unnatural looking. So we do enhance our results with combination therapy, as I've mentioned. And oftentimes we'll do the treatment, another treatment, either a month before or a month or two after. We can do neck treatments, fillers, fat transfer, and lasers. So that's all I'm going to talk to you tonight about. If you have some questions, that would be great. This is how you can reach us. And I do have a few things on my Instagram. I'm not very good at social media. I don't really answer you, but you're welcome to look certainly on our website as well. So thank you. Thanks, Emily.
Awesome. Thank you so much, Dr. Butterwick. Okay, we'll get into some of these questions. So the first question is, how long does the InstaThreads last?
Well, they will last about 18 months, a year and a half to 2 years. Now, as I mentioned earlier, the PDO threads will last about 6 months before they start going down. The InstaLift threads will get better for about 6 months and then last about, a year to 2 years after that. If you just put one suture in on each side, of course, it won't last quite as long. But so I usually like to put about 3 minimum. This isn't all the time, especially if we're just correcting an early jowl from a facelift that's falling. But you're going to get a good duration with these. And many of you in the audience have probably had a filler. It's actually not more painful than getting a filler.
Awesome. Okay, next question. I unfortunately sleep on my face. Would this ruin the results over time?
Well, that we really don't want you to sleep on your face that first maybe 3 days. So it won't ruin the face over time, but it's not good for us to sleep on our face, but you're going to be miserable if you don't get any sleep. So there is a way to make kind of a pillow nest and kind of force yourself to sleep on the back. And maybe if you turn a little bit, if you really do sleep on your face, I suppose you could get some sort of, there are a zillion different types of pillows. A pillow that will save your face where your head is kind of balanced on the forehead and not putting so much pressure. That could be a problem if there's really no way for you to sleep on your back for 3 nights. Maybe we'd give you a little sleeping aid if that was necessary.
Awesome. Okay. Next question. If you need fillers also, do you do the fillers first or after this has settled?
Yeah, that's a very good question. And the answer is either one. Sometimes if we know for sure you're going to need fillers, we'll do, and we may do them on the same day. I often do the lips on the same day because you're kind of numb, you're already in there, and we can do that. We can do Botox on the same day. And occasionally I'll do some filler in the upper cheek and put those threads in the lower. And so we can do them, either 2 weeks before, 2 weeks after. Usually we have about a month. Now I told you that sometimes we don't need as many fillers if we're doing a thread lift. So sometimes I'll do 5 or 6 fillers in a patient's face to really lift it up to get that liquid facelift, and sometimes they even need more. Well, if you do the InstaLift first, we're pushing the volume back up where it should be, so we need much less filler. But we might wait 6 weeks, 8 weeks before we do the filler, because we know it's going to, we're going to get the InstaLift effect. We're going to get that Sculptra collagen growing effect in the face.
Okay, great. We have a few questions asking about ages. Some asking if it's ever too young to get the InstaLift, and then others asking if there's a ceiling age. One person in particular is asking if they would be a good candidate at 76.
Oh, yes. Okay, well, probably the oldest patient I've done, I can't remember, I think she was getting ready for her 90th birthday. So,
Wow.
at that age, you for sure don't want to get a facelift. And so the patients are commonly over 75. I don't have too many 90-year-olds doing it, but you can still get these if you're older. You are a little slower to make the collagen. So the suture might will still trigger collagen and you'll still respond to it. It might take a little bit longer. Older age isn't a factor. For a younger age group, usually you don't have as much laxity. But like that one patient I showed you in the chair, she was talking, she's pretty young in her early 30s, and she does feel like she's dropping, especially after pregnancies. Women can feel like the face has lost elasticity, that it's fallen down. So we do a lot of women in their 30s. That's not too early. Does a 20-year-old need this, or 25-year-old? Probably not. Usually in the 25-ish to 30 age group, a little bit of little baby Botox, some good skincare goes a long way. If you do need it, there may be some skeletal features. I have one patient who has Bell's palsy. There's reasons why we might need to lift. Maybe terrible acne that caused so much damage that there was an early loss of elastic fibers. So the age doesn't really matter with this. I feel like I'm giving long-winded answers, but hopefully
No, that's
all the
awesome.
bases.
That's great. Thank you. Okay. This one says, can you talk about the lower neck and forehead and brows?
Yes. The lower neck is, we mostly raise it by doing the upper neck. The skin is so very thin in the neck that you could see the suture for a while. And there's so much twisting and turning of the neck that we usually don't put them way down in the lower neck across, although we may put them diagonally to lift up. So we can put these in the lower neck, but especially just anchoring this, pulling this back and getting a couple right here will totally lift your lower neck. So usually we don't need them in the lower neck. These particular sutures, the Silhouette InstaLift, are not designed to go in the brow and forehead. They're too long. So you need a short one. There's a PDO one that goes right to the eyebrow. You put a little cannula up and anchor it up. But I feel that for all the trauma of that, it's only going to last 6 months. That maybe a Botox brow lift, an Ulthera, some filler. I often put filler along the hairline. So I don't feel like I absolutely need a suture to get where I want to be for the upper face. So I haven't actually used the PDOs in that area, but I have some colleagues who use them successfully, but it's a short-term proposition.
Great. Okay. This one says, what are the cones made of and how is the collagen generated?
Well, the cones are made mostly 82% poly-L-lactic acid. That's in the lactic acid family, the glycolic family, plant-derived, and they're very, very safe. They've been used for suture material for surgeries for years, and they dissolve when the body sees it. The fibroblasts work on dissolving the suture, and when it's doing that, it produces collagen at the same time and anchors that suture up, anchors the tissue up with your own natural collagen. This is the same material that's in Sculptra. Sculptra is an agent we use for the liquid facelift. It's a watery solution where we put little tiny specks of Sculptra, we dilute it down, and we put it in the temples, the face. We use it in the chest and arms, and even the buttock to build collagen and build volume. So, but with Sculptra, you can't say, I want to fill the face and just pick up this little part of the face. I can't lift it. So that's why these sutures, where the sutures come in. So everything has a little niche, but these sutures are so valuable in lifting up. And because they're the Sculptra, they'll be slowly absorbed, but replaced by your body's own collagen. We have these wonderful cells in our body called fibroblasts, and they produce collagen for us. Whether you have a laser procedure, such as our special Take 10 big CO2 laser resurfacing, the cells will pour out a ton of collagen, or even a light Fraxel, a clear and brilliant laser that stimulates collagen, Ulthera, Thermage, all of that stimulates collagen, some to greater or less degree. But for the deeper tissues, for lifting that sagging, we need to lift them somehow. And that's where the sutures come in.
Awesome. Okay, well, we're getting pretty close to time, so this will have to be our last question. So this person asked, have any patients had pain for a longer time than expected, or does it usually resolve pretty quickly?
You know, I haven't had anybody with prolonged pain, or I haven't heard of prolonged pain either. So they shouldn't hurt. Now everyone has a different pain tolerance. I thought it was sore, like the first 2-3 nights. I thought, ooh, it's kind of sore to sleep on them. I'd take a couple Tylenol. I didn't really think about it during the day, but for some people, soreness can be, they just feel pain more intently. That could be more pain for those people, but I don't think I've ever had to prescribe pain pills for these. So they should not be particularly sore. If they are, they might have been put in the wrong plane, the wrong tissue plane. They might not be in the proper place. The other thing I wanted to mention is some people, patients who say, well, what if they pop? What if they break and fall down? I've never heard of that happening, except in one instance. A doctor friend told me one of his patients the next day did aerial yoga, spinning upside down on one of those swings. The sutures all came loose. So I wouldn't advise that.
Wow.
We kind of tell you to just take it easy for those first couple of days while they anchor in. But it should just be a little bit sore.
Okay, awesome. Well, thank you so much, Dr. Butterwick, for all that awesome knowledge about the procedure and answering so many questions. It's been really great.
And we do invite you to come in for consultation about this if you're interested, and maybe we would steer you into one of the other things instead, whatever seems best for you and most efficient to correct the problem that we see.